According to the Center for Disease Control, in 2012, emergency rooms had over 129 million visits nationwide. 1 in 8 of those visits were for mental health or substance abuse.
Really what emergency rooms need to be doing is helping people in medical crisis. So it's not the ideal place for someone in mental health crisis.
And up until this point, we have not had dedicated staff really to address that ongoing crisis.
Before seeing a psychiatrist or advanced practice nurse, there was always a waiting list, and that waiting list could be anywhere from 2 weeks to a month.
I think oftentimes consumers don't even want to go to the ER because they don't like sitting there, so they don't go for treatment. And then what happens is it escalates to the point where they have to be hospitalized, and that's definitely costing a lot of money from the community, Medicaid, Medicare, federal government, state government, to have them in the hospital.
Early intervention is widely considered one of the most important components of overall wellness, especially when it comes to mental health. The Wellness and Support Center affords the solution to this ongoing challenge.
Well, I like to describe us like urgent care for mental health. So if you're having a mental health crisis, you're having anxiety, stress, whatever it may be, you can walk in our doors 7 days a week and see someone basically immediately. You come in, we'll screen you, make sure you qualify for the program, and send you on your way with an intake, seeing a prescriber, and then wrapping services around to help you stay stable for the next 30 days.
The people we think are going to benefit from this program are a wide variety of consumers. It's anyone who may never have sought out mental health treatment before, who is experiencing symptoms and they realize they need treatment. It could be consumers who are already linked to services, outpatient services anywhere else. It could be from Vantage, Care Plus, West Bergen, or comprehensive behavioral health care.
On the day the Wellness and Support Center opened, Senator Richard J. Cody told about the challenges with mental illness in his life.
My first child was born October 21st, 1984. And my wife, during the pregnancy, was not herself. So after she gave birth, she came to me and said, "I'm depressed and I have thoughts about harming Kevin." So I immediately called the psychiatrist and got her help right away. And after a couple of weeks, the psychiatrist called me and said, "Listen, your wife is seriously depressed. She needs to be hospitalized." I mean, I'm 38 years old, and my wife is gonna have to go to a psychiatric hospital. I'm driving her down to Carrier Clinic, and I'm upset. And there's tears in my eyes. And my wife's telling me to divorce her because she doesn't think she'll ever get well, and to marry somebody who would be a good mother to our child. And the weeks previous to her hospitalization, she wouldn't speak to her family, she wouldn't talk to her friends, only to me. When she got her prescriptions, would go to a drugstore 10 miles away so nobody would hear what kind of medication she was on. So that showed me in a very vivid way of how embarrassed she was. But the big difference was that my wife said to me, "I need help." And so many people are afraid to say, "I need help." So my message to you is there should be no embarrassment, there should be no shame to get help for mental health.
For those in crisis and their families, the Wellness and Support Center provides a clear plan of action.
You know, if you have an emotional problem, your family deals with it, your spouse deals with it, your siblings deal with it. So when we help somebody with dealing with an emotional problem, you know, we're helping more than that person. And that's a tremendous feeling of accomplishment. Somebody can come here and be seen for 30 days consecutively, can be seen multiple times during the course of the week or even in a day. So we can provide that continuity of care, we can provide that linkage into the community. We also have rapid implementation teams that, you know, we can also provide that care. So, you know, the access issue and the follow-up are probably the most significant things that we can provide.
If they come to a program where they can walk in, they can feel relaxed, comfortable, they can meet with somebody who can talk about their anxiety, learn coping skills, maybe be put on medication that helps with those symptoms, they can then go back into society and do all the things they need to do, take care of themselves, their family, work, and feel good about themselves.
With this program, we now have a clinician on site every day that is part of our team, part of our collaboration, that we can call on her, the clinician, to say, hey, listen, this is what's going on with the individual. What do you think? What do you recommend? And having that is such a difference from having to resort, again, to calling an ambulance, expensive care, only to have the person return back to us within hours and not really accomplishing anything long-term or anything lasting for that individual.
Touched by a tragedy in her life, Senator Loretta Weinberg also expressed her support for the Wellness and Support Center.
And then there's the young man from my own hometown of Teaneck who killed himself in the basement of the Garden State Plaza, who had sent a text at 2 a.m. to a friend that went something like, "Need to talk." This young man, it was almost closer to home. He worked in the pizza shop right across the street from my office, so we all knew him. Friendly, smiling, well-mannered young man. So people of all demographics and backgrounds are affected by mental health illness. Hopefully it will get to the stage where that young man who felt he had nobody to talk to will feel confident enough and relaxed enough to reach out, and the resources of the coming together of legislation, of government, of state, of the county, of our local municipalities will help prevent these kinds of tragedies in the future.
The goal of the Wellness and Support Center is to provide optimum behavioral health care that is responsive to community needs.
This will reduce the demand on police departments per se, or other community agencies that are currently feeling the burden of providing the service, simply because we're a referral source that's available to them. And they can simply call and we can respond to that, or they can send a consumer to us, we can go out to them, we can work collaboratively with them so that it'll be a joint kind of a process in providing care. And certainly collaboration is an important piece of service.
Knowing they have a place to go and a place where they can get treatment, they're going to feel better about themselves. It's going to bring the dignity back for them. And once they feel dignity, they're going to walk different in the community. They're going to get respect from the community, or at least certainly not ostracized by the community at large.
One of the challenges in being the county's homeless shelter and single point of access for individuals who are either about to experience homelessness or are experiencing homelessness is that many of them are in crisis. Through having a clinician available to us when an individual comes in that's not linked up to services, we can rapidly get them going, get them the services they need so that they can remain stable while we're working to end their homelessness. We were really unable to provide that for them in a timely way before we had this Wellness and Support Center at the center.
What I would like people to know about the program is that we're really here to help. If you're working with someone who you think is in crisis, if you come across someone who seems like they're in mental health crisis, but you're not quite sure, call us. Call, talk to one of our counselors, find out about the program. Give us the chance to help. And as you see us helping, I think that will really show people what we can do.